Welcome to Akhand Vidyashram, the first institute of impeccable wisdom, the walking, talking encyclopedia. Blood circulation, the circulation of the human blood. My dharma, the impeccable wisdom, the wisdom of the divine nature. My greatest discovery, Divyank, the divine design of nature, with which the perfect object of the universe are designed and created. Divyank is the reward of 60 years of integrated knowledge. Impeccable wisdom is enlightening. Akhand Vidya wisdom is empowering. To understand blood circulation in the body after being pumped by the heart is the objective of this particular video. To understand that, first let us understand how it is the perfect human heart anatomy, 4 chambers, 4 valves. Size and shape of heart is in Divyank ratio, in the ratio of 3:5, or 38.1966% width and height of 61.8034. This maintains because the core of the heart is most important, it's vital, and it has also got a pacemaker. So it's very clear that we should understand the heart very clearly because life depends on heart and blood. Collectively, they are effective transport system for all the vital nutrients of the 100 trillion cells for health, wealth, wisdom, and happiness. Without all the 100 trillion cells are provided with all the requirements, 100%, they will not be physically healthy, emotionally stable, mentally powerful, spiritually integrated, and do the kind of wonders which human beings are expected to have. We are the divine design of nature. We are the only one who can understand divinity, the whole universe, directly with or without instruments, and be at the same time in tune with universal consciousness and be happy with it. From that angle, this particular video has a very important role to play. How the blood is circulated, how different organs get different percentages, and why do they get. I have used the pictures which are normally given. I am going to rectify the pictures keeping Divyank in mind and which are very close to the values which are already given. But I want to set record. The size of the heart is in Divyank ratio. The shape is like a fist, like the fist of the person. Size is amazing. And then all the 100 trillion cells then use carbohydrate and oxygen. They produce carbon dioxide and water. Water is used in the body where carbon dioxide has to be thrown out. 61.8034% of the carbon dioxide is expelled by the lungs and remaining is retained for hydrochloric acid production in the stomach, intestines. At the same time, other parameters of nature where carbon dioxide has a role to play. Remaining is thrown out. So blood produces carbon dioxide, it goes to superior vena cava, inferior to the right atrium. That's the entry of the blood, blue blood into the heart. From there through tricuspid valve, goes to right ventricle. From right ventricle through pulmonary semilunar valve, as you can see on right top, go to the pulmonary trunk, pulmonary arteries to the lungs for oxygenation of deoxygenated blood into oxygenated blood. Then pink blood from lungs is carried from pulmonary vein to left atrium, mitral valve or bicuspid valve to the left ventricle, aortic semilunar valve to aorta and to all the cells. This is how the blood circulates in the body. This is very important. This is maintained perfectly with a blood pressure 120/70, end diastolic 120, stroke volume of 74, ejection fraction of 61.8%, and cardiac output, cardiac cycle, and all the parameters within Divyank. I can assure you, you'll have no problem provided your biochemistry is also as perfect as Divyank. Perfect human anatomy, perfect human physiology, perfect biochemistry and psychology should be with Divyank and you have no problem. Having said that, now let's move on to how the blood is circulated. This is pulmonary systemic circulation pictures. You can see the heart in the center, superior vena cava, inferior vena cava bringing blue blood to the right side of the heart, from right atrium to the right ventricle. From there it goes to the lungs. You can see pulmonary circulation 9%, where oxygenation takes place And then after oxidation of the blood, deoxygenated hemoglobin is converted oxygenated, is brought back to the heart in the left atrium, to the left ventricle, through aorta. This goes to the circulation, you can see it. And then how different parts get. Heart gets only 7%. Anyway, I'm not going to detail in this particular thing, but I want you to remember to see one thing right at bottom. Veins, venules, and venous sinuses contain 64% of the blood. In my opinion, 61.8034% should be ideal to make the human body perfectly normal. See, this is neither more nor less. And remaining blood is 38.1966%. If that is maintained, you should have no problem whatsoever. To make this picture a little more clear, let me give you another picture from internet, which is established. Now I am using internet pictures which are already known, which are the popular and the first choice. Now, to make things, first picture as well as second picture a little clear, you can see in the left side in the middle, you have lungs, you have capillaries, and lungs and capillaries with oxygenation takes place, and the blood is brought through pulmonary vein to the left atrium, to the mitral valve, to the left ventricle, and to aorta, and then to elastic arteries and arterioles, which are very elastic in nature. They can accommodate quite a lot of blood this way or that way, and then they go to arterioles with variable radius, and then they go to capillaries to distribute to the 100 trillion cells. All the exchange is required, and after having done that, it goes to the venules, and you have that. Now you can see there's no return form, it is only forward. There are valves which make sure the return does not go, and then blood is brought to the right heart, then there to the lungs, and this circulation goes on. This is little better picture than the earlier pictures. Now, ideal systemic circulation, in this particular picture you can see very clearly. Right on top you have the right heart and the left heart, and you have the lungs. And as I have told you in one of the videos earlier, ideal cardiac output should be 5 liters per minute by and large to be perfectly healthy. Out of this 5 liters, 0.70 liters per minute goes to the brain. Brain has almost 55 ml per 100 grams of brain gets the blood supply from the heart. Heart gets 0.20 liter per minute, which is more than the brain supply of 70 ml into 100 grams of heart. Very vital. But brain has got 14% of the venous returns, because 0.4 is equal to 14% of the 5 liters. 200 ml is equal to 4%. Then third organ, which is very, very important, comes is the liver, because it is responsible for liver digestion, analysis, assimilation, and the perfect use by the body. So liver gets plenty of blood, and that is 1.35 liters per minute out of 5 liters, which is equivalent to 27%, and is also equivalent to 100 ml per 100 grams per minute. Liver size is smaller, but it gets more blood, is profusion of blood, because all the absorbed material from gastrointestinal tract is carried to the livers for assimilation into the products to be used by the body perfectly. So it has to be very, very high. Third organ which gets equally important roles is kidney. It gets 1 liter per minute, which is equivalent to 400 ml per 100 grams per minute. Now you see, brain is 55, heart is 70, liver is 100%, but kidneys are 400 ml. And the blood supply is 1 liter, which is equivalent to 20%, but keeping the size of kidneys in mind, 400 ml is almost like 8 times of the brain and almost 6 times of the heart and 4 times the liver. Why so? Things are very clear, because whatever 100 trillion cells use the material from inside the body, which is got from outside, has to be eliminated of all the poison products which can damage the person. So both the kidneys have to be perfectly healthy to keep all biophysical parameters perfectly normal with Divyang. So no wonder it has very high supply, very efficient. It has to be done very, very well. And that is reason one of the slides which I'm going to show is glomerular filtration rate. Now, from that point of view, you have the skeletal muscles get 1 liter, because muscles also have to be very, very strong. Unless until muscles are strong, you can't have a physical health. For physical emotional health particularly, you have important dependence on skeletal muscles. Is for movements, excellency, everything. Whatever we have to use for the cell has to be bought from the market and other places through skeletal muscle work alone. So percentage of blood, which is equal to 21% out of 5 liters, equal to 1.05 liters to skeletal muscle, is very, very important. And its amount of ATP it produces to run is very efficient. Next in the line is skin, 0.25 liters profusely done, is 10 ml per 100 grams of this, which is 5%. And skin also is very useful eliminating many of the things like kidneys, and also to bring in a lot of other advantages like vitamin D, etc. from the sun and otherwise plays an important role. The least one is 5% in this part. Then structure which comes to play important role is bone and other tissues. It gets 0.45 liters per, which is 9% and equivalent to 3 ml plus 100 gram. Bones are big size, scattered. Percentage might look, but it is 9%. Now, keeping these particular ratios in mind, ideal systemic circulation to make sure that blood supply to the brain is efficient to the 14%, and because brain has to think, rationalize and do things in tune for the body, keep unconscious, subconscious and conscious and superconscious all within the brain is very, very important. It's right on top. Heart is the second one. Without the heart we cannot survive. Without the liver we cannot survive, because assimilation of the perfect is required. Kidneys are important because it has to eliminate all the unwanted products. Skeletal muscles have to be there. Unless until we are physically very active, we can be perfectly healthy, wealthy, wise, happy person after. Skin has also got to accumulate. It is our external barrier to make sure that nothing from outside can get inside. And bones and other tissues are as important as other things, because they are also play an important role. So I can put in this to, I can say all the 10 different organ systems of the body important. In other words, you can say human being can be a bunch of atoms, elements, molecules, compounds, cells, tissues, tissue organs, organ system and organism. For that, the ideal systemic circulation of this nature is absolutely essential to be maintained, to be kept alive without any block anywhere in the body. So no wonder this particular slide plays very important role when it comes to the perfect physical health, emotional stability, mental health, religious health, social health, intellectual health, and to make a person to be a perfect human being, to be in tune with universal consciousness. All the circulation in this way is very, very important. So having understood that, now let's move on to the next slide. As I've been saying from the day one, when I'm talking of heart muscles, that heart has to have a blood pressure of 120/74 mean arterial pressure is 93. If that is maintained, from that angle, mean human blood pressure is very important. So when iota comes, blood pressure is 120/74. And mean arterial 93 goes on. Then slowly, as from aorta to large arteries, to small arteries, to arterioles, to capillaries, it starts coming down. At the venule, it comes down quite a lot. And small venules, large venules, vena cava, the blood pressure is very, very small and minimal in quantity. But that is as far as systemic circulation is concerned. But when go to the pulmonary circulation, you find the pressure is more in the pulmonary arteries, arterioles and capillaries, and then comes down a little bit, and pulmonary vein back to the left atrium but it is better than what you see in systemic circulation. This is also something which I want everybody to understand. Systemic blood circulation is much better in aorta and is slightly better than what is in large arteries, small arteries, and then how things go. So I'm sure by this time you realize that mean arterial blood pressure of 93 and then gradually reducing to more or less 2-3% and then increasing in the pulmonary and then bringing it back to this is important for everybody to understand. If this pressure is maintained, volume is maintained, you should have a perfectly physically healthy structure altogether. So far one thing has been made very clear. There are 100 trillion cells which use carbon dioxide, proteins and fatty acids and also can use oxygen to produce carbon dioxide to be expelled it out. So structure is clear, circulation is clear and mean arterial blood pressure is clear. End diastolic volume of 20, stroke volume of 74, ejection fraction of 61. If all these parameters are maintained, thou shall have no problem whatsoever to lead a perfectly physically healthy life, emotionally stable, mentally powerful, spiritually integrated, very intelligent, in tune with the universe, in tune with everything. You could be literally like a living, walking, talking encyclopedia of divinity by and large. And I do believe every human being is designed to be custodian of the world. And we are only capable of bringing peace to the world, provided we love everything, do everything for the good of everybody. It is possible, and that's exactly what I'm trying to do. As I told you in the beginning, this glomerular filtration rate in heart is very, very important, and this particular picture I purposely brought in to add one complement to the whole thing, particularly with respect to capillaries. Right, you can see the afferent arterioles which bring blood into the glomerular capillaries in the Bowman's capsule in the kidneys. Filtration takes place and that is called glomerular filtration rate, or GFR. Ideal is 125 ml per minute. If that is maintained, thou shalt have no problem whatsoever. And then efferent arterioles bring the blood back, and there are 4 levels of filtration or kidney filtration which take place. One is filtration, the ultrafiltrate, which takes place in the glomerular capillaries from GFR of 120 mm. That is number 1. Number 2 is reabsorption, and number 3 is secretion. 4th is excretion. Now the question comes, if there is ultrafiltration taking place in glomerular filtration up to 125 ml per minute, why do we need to reabsorb? Question of reabsorption is very clear because in capillaries you have only single cell layers, so anything up to 4 micron size from the blood can filter out through higher concentration to the lower concentration by nature law without any external force. Since that size is water, glucose, electrolytes and all the smaller particles which need to be used by the body. So as a result, water has to be reabsorbed, glucose has to be reabsorbed, all the electrolytes have to be reabsorbed, and everything has to be maintained. And that is what is called reabsorption important in peritubular capillaries for survival. Now the third question is secretions. When everything could be filtered in glomerular filtration, why do you need a filtration again? Question is very clear. Anything which is larger than 4 micron size cannot pass through glomerular filtration layer or bromine capsule to come by itself. And they could be dangerous. Since they cannot be used dangerously with a natural law from higher concentration, lower concentration, they need to be secreted from peritubular tubes to be excreted out. And they are larger size, which cannot be, and for that, you need secondary excretion, use of force to throw them out. This is where sodium-potassium pump plays an important role. Maybe sodium with glucose, sodium with amino acids, or sodium and potassium to throw them out, and all the harmful products which are larger in size also done the same way. Deoxygenated blood is taken by the renal vein and urine excretion comes down and is thrown out of the body once for all. So having explained that, let me sum it up very clearly in the next slide. This particular slide I am going to show. Now, heart is the center, is the seat of survival, most important, and since all the requirements of the cells which are got from gastrointestinal system to the liver to the heart have to be circulated clearly. Then, and complete perfect heart anatomy, physiology, biochemistry, psychology have been explained, and from that angle you can definitely say if a perfect heart with the perfect cardiac output, cardiac cycle, mean arterial blood pressure of 93, these maintain all these structures and maintain circulation is very clear. That systemic circulation of 38.19 with respect to arterial blood and 61.80 to the venous blood is maintained. This is again Deviank ratio. In that event, you should have no problem whatsoever to make sure that you are leading a perfectly healthy, wealthy, wise and happy life. This particular objective is again brought it to show arterial blood is 38.19 and venous return in the lower parts and body is 61.8034, and that is what is systemic circulation and also pulmonary circulation. If all that is maintained throughout, you will have no problem. As I said, you throw 61.8034% of carbon dioxide out, and that is also there in the venous blood. Same amount is designed. So respiration also is designed. The inspiration is 38.1936 and expiration is 61.80. So ratio is again Deviank. Since again and again I'm saying, if you remember Deviank, you have least to remember, but everything perfect to be given. You don't have to talk of the various things which other books are giving. This objective of Akhand Vidyashram is to give you impeccable wisdom, knowing which everything perfect is known. Let us not confuse with disease models. Let's confuse only of perfect things. So thank you very